What are the key elements of a patient's self-care plan?
Patient education is really important. You need to know about your disease and understand it so that you can manage it well. It's important that you're part of the decisions around your care plan. Patients have to have a way of monitoring their symptoms. It could be journaling, it could be finding a way to be able to document how things are going in between visits. There's also a lot that patients can do at home on their own in between their physician visits outside of their medications. So, to manage the pain, so things like heat and cold, or alternating the two, or relaxation techniques, or other things to manage pain. There's also all the healthy lifestyle parts that are really important for managing a disease. So getting adequate amounts of rest, managing one's stress, getting adequate sleep, a person's diet, having a healthy, well-balanced diet. Quitting smoking is really important if people have ankylosing spondylitis, because we know that people who smoke and have ankylosing spondylitis have worse disease, more pain, more inflammation, and don't respond as well to treatment, so that's really important. And lastly, there's the physical activity and exercise that is so important to patients with AS.
What specifically are range of motion exercises, and what are their benefits for patients living with ankylosing spondylitis?
So range of motion, like the name implies, is an exercise where you move its joint to its full range of motion. It's different from stretching, which is trying to go past your normal range of motion, which some exercise classes will sometimes ask people to do. So people with ankylosing spondylitis have to be careful to not try to overstretch. You want to move it to its full range, but don't try to stretch it beyond, because that can actually cause more pain. And it's very important because this is how people will keep their mobility. We say you move it or you lose it. So if you're not moving a joint to its full range regularly, slowly, the capsule kind of shrinks and the joint mobility gets less and less.
What are the differences between strengthening and aerobic exercises?
So those, like range of motion, strengthening, aerobic, those are the three components of an exercise program that a person should incorporate into their exercise program. And the strengthening exercises are those that allow you to build the muscle mass around the joints. And those are important because strong muscles support the joints well, and they are what keep the joints stable. And the aerobic exercises are the exercise that get your heart pumping. So they're the exercise where your heart rate increases a little bit, and they're really important for your fitness level, and they're really important for your heart health.
What are some diet considerations patients living with ankylosing spondylitis should think about?
So that's a common question from patients. The important part of the diet is having a healthy, well-balanced diet, following the recommendations of the food guide. There's not sort of a specific diet that is good for ankylosing spondylitis. So if people stick to a healthy diet, making sure that they have foods from all food groups, and making sure that they have adequate vitamin D and calcium, which usually is not sufficient in our diet, especially the vitamin D, because people with ankylosing spondylitis, as we mentioned earlier, are at increased risk of osteoporosis. So that would be one part that's important to supplement. And then looking at, perhaps some anti-inflammatory foods or omega-3 fatty acids, for example.
What aspects of their disease can patients not control?
I think there's a lot that patients can't control, and I think it's really important for people to recognize that. As much as we want to empower people, for them to understand what can they do that will make a difference, and definitely there's a lot in a person's lifestyle that that they can control and that can make a difference. It's also important for people to realize that sometimes your disease will flare regardless, even if you've done all of those things. And it's important for people to not blame themselves. So, there's things you can control and there's things you can't control. And despite doing everything right, you might still get some flare-ups that just happen on their own, and that's out of your control.
During their daily activities, what should people living with ankylosing spondylitis remember?
It's really important for people to avoid prolonged sitting or being sedentary for any period of time. So it's really important for people to get up and walk around, or, if they at work, for example, if they can sit and stand and move around and take what we call these little micro breaks where they'll stop their activity for like a 20-second stretch. So that's one example that's really important. Also, it's being very careful of the posture. And that's particularly important in ankylosing spondylitis, to avoid the stooping, which is the bending forward. So making sure that people stand straight, sit straight, that they pay attention to their posture, holding the joints in a way where the joint is in a neutral position so that the joint is rested.